morning, everyone. Today is Thursday, October 15th, and it is 6:35 in the morning, and hubby over here is driving me to the surgery center. So it is surgery day. I am a bit nervous. I woke up feeling nervous this morning, and he can't come in with me at all. He can only drop me off at the front entrance and leave, and I guess I should have expected that, but I didn't really know until yesterday when the surgery center called me to tell me, and I had a moment of a breakdown and I started crying. Just because he's my rock, he's my support, and I don't want to go through this alone. And I know he'll be there to pick me up, but it's like I have to check in an hour and a half early before my actual surgery starts. So I'm gonna be there alone, freaking out. But they promise to take good care of me, and I trust my doctor. So I have absolutely no makeup on, no moisturizer, nothing. They tell you to wash before with unscented soap, and then you can't put anything on. So I have nothing on my face at all right now, and my lips are dry, my face is dry, my skin is dry. We are on our way. The surgery center is only about 17-18 minutes from my house, so it's not far. I will keep you guys posted. Bye. Hey everyone. So I am home from surgery. The surgery went really well. About 6 hours post-surgery. I am not in any pain really. I'm stiff. But I did get these, I have a wristband for it. I don't know if you could see it. Exparel is what it's called. But it's like pain injections. It's opioid free, but they give you it when you're in surgery, and it's supposed to help for a few days afterwards. So far it is helping a lot. I'm not really in any pain. My throat does hurt from the breathing tube, and that's why my voice sounds this way. And I'm not out of breath, but it's a little bit harder to breathe and talk. But I did want to update you guys. And yeah, so I'm feeling good. I can show you that's what the tops look like. So the implant is really high. It'll take them a while to settle down. Can't wait to take off my body wrap and see my stomach. I'm really excited for that too. My husband got a little spot set up with the recliner, and I have my blankies because I'm freezing, and I'm feeling good right now. 6 hours post-op. I'm feeling pretty good. I might say a different story tomorrow. Tomorrow I might be in tons of pain. I hope not, but I want to say hi. The kids aren't here. The kids are with my dad, and feeling good. It's quiet. It's the hardest part right now for me is not being able to cuddle my dogs, especially Winnie the puppy. She keeps trying to come see me, but she doesn't know how to be gentle. She's too hyper because she's still a puppy and she weighs a ton. So that's been difficult for me because I love my dogs and I love snuggling them. And when I first got home, I could not stay awake. Every 5 minutes or 3 minutes, I would get up and I would try to message everyone on my phone or check my phone, and I would fall right back asleep. I could not stay awake. I probably slept for an hour or so straight, because before I couldn't stay asleep either. I would fall asleep, wake up, fall asleep, wake up. I was trying to stay awake so I could message everyone. I know my husband did a good job about messaging my close friends and my family to let them know I was okay. I was trying to re-message everyone too, and I could not stay awake. Then I would fall asleep for only a little tiny bit, and then I'd wake back up. So it was hard for me to stay awake, but it was hard for me to stay asleep. But then I finally was able to sleep for about an hour or so, and now it's 10:05 p.m., and now I'm feeling a little bit more awake, and that's why I'm just now jumping on instead of sooner, because I could not stay awake at all. But I have not eaten. I haven't eaten in 24 hours now. Had to fast before my surgery. And then when I got home, I just was not. I tried to drink some juice, and I was not feeling good. It instantly made me feel nauseous. So I am going to try to eat something like yogurt, to have something in my stomach, and then I'll probably go to bed for the night. I'm staying downstairs for a while. My husband moved. We have a recliner in our front room, like where the kids hang out. He moved the recliner into the living room where our big TV is. So that was really sweet of him. So I will just sleep on my recliner, and I think he's going to sleep on the couch with me while I'm down here recovering. And I will check in with you guys tomorrow, which will be Friday. Hey everyone, it is the next day, so for me it is Friday, October 16th, and I wanted to just give a little bit of an update. Excuse my voice, it's still really, my throat is still pretty sore and it's just dry, so excuse that and excuse my appearance. I'm still in the same recliner as yesterday and wrapped up in blankets, and overall I'm doing pretty good though. I didn't start to experience pain until around 2 a.m. last night. I woke up to use the restroom, and I had to wake up my husband to come help me get up out of the recliner and go to the bathroom, and it was at that point that I started experiencing pain. So that was the first time I took pain medication. It's really hard to sleep in a recliner when you're used to sleeping in like your nice big cozy bed. And I am a side sleeper. I love sleeping on my side, and so I'm sleeping on my back, kind of sitting up in a recliner. So it's a little difficult, but it's what I gotta do. So it's 8:46 a.m. right now on Friday, and I just now took my second dose of pain medication. I hadn't been able to eat or drink anything last night. I mean, I did drink water, but I wasn't able to eat anything. I did try drinking a naked juice. Took like 2 sips, and unfortunately I threw up. And even though I had anti-nausea medications in my IV, and I took Zofran here at home in tablet form, my body just hates anesthesia. I was able to drink some today, and I just ate like a Nutri-Grain bar. So that was probably like 15 minutes ago. I ate a Nutri-Grain bar and drank some more water. In my water, I have Miralax. The nurse at the hospital recommended to take Miralax for the first few days until I have like a regular bowel movement. And then after that, she said make sure to stay on top of taking stool softeners, which I also mentioned in my previous video as well. So I will be staying on top of all of that. And I gave myself an injection. I'm sorry, I forget what the injection is called, but it's to help thin my blood so I don't get blood clots, because my surgery was so long and I can't move that much. We want to be on the safe side, so my doctor prescribed the injections. I showed that also in my previous video. So I had to inject it in my thigh. All in all, I'm feeling okay. Yeah, I'm sore and I'm more stiff today than I was last night, but I haven't cried at all. And if you guys know me, I am a big crier. I cry a lot, but I haven't cried at all. I haven't been in that much pain to make me cry, and that's pretty shocking to me. I thought I would cry like immediately, but as for the pain, so I got my tummy tuck done, and I got breast lift and breast implants, and my breasts are hurting way more than my stomach, which usually it's opposite. Usually your stomach hurts worse than your breasts. But since I got breast lift and implants, I think it's just throwing my body for a loop. And so those hurt way more. And they're still really high. They're going to be for a while. As you can see, they're all the way up here. Really tight. But like I can see down, and I can see like they're lifted, and oh my gosh, I'm so excited. And I think that's also why I'm not focusing on the pain, because I'm so excited to see my body and what it's going to look like. And I know it's going to all be worth all of this pain and all the money and all of that stuff. So tomorrow, Saturday, October 17th, is when I'm going to be going in for my post-op appointment with my doctor. Normally after surgery, you see your doctor the next day, but since I had so many procedures done at one time, he really wants me to rest today and stay at home and not get in and out of the car. He did offer for me to go in today if I truly felt like I needed to, but I don't. I feel like the drain output is within normal range. I'm not bleeding anywhere else. I'm not in excruciating pain. So I did say yes, Saturday was fine for my post-op appointments. And he's going to take all my wraps off, so I'm going to be able to see a little bit what I look like. I'm going to be all, bruised and have all my incisions and stuff, but I want to see, and I'm excited to see what I look like. My kids aren't here. My youngest comes back tomorrow, and then my older 3 kids come back on Monday. I do miss them, and but I'm also enjoying the quiet time at home. And so this is just a little update this morning. I will continue to update as I go through my days. Hey everyone, so it is Saturday. It's 11:44. I'm supposed to be at my appointment at 11:45. Luckily, my doctor is right down the street. But I am headed to my post-op appointment, and he'll be able to take off the wraps and see what I look like and make sure everything is healing as it should be. And then we have to write down every time we drain my drains, like write down how much is coming out. So we have a sheet that we have to show him too, just to make sure the output in my drains is good as well. Okay, so I just got back from my post-op appointment. It went really well. The doctor said all of my incisions are looking normal, healing normal. He took the wrap off of my breasts and put my sports bra on. So here, like I said, they're still really high. They need to settle. I can start like massaging them to get them settled. I still have my belly wrap on. I'll have this on for a few more weeks. And I have my drains tucked in here as well. But the doctor said I am healing nicely and I can take a shower as of tonight. He had to do a different kind of lift, so I'll explain that in a little bit when I'm sitting back down. But here they are. When he took the wraps off and I looked down and I can see straight down, it was quite amazing. So it is still Saturday when I'm making this video. It's about 5:30 in the evening. Just wanted to make this video to give all of you an update and to also share a little bit about my surgery experience. Don't mind this. This is all bruising right here, so don't mind that. I am doing pretty well. It's 2 days post-op, So I had my mommy makeover surgery on Thursday, and what I had done was a tummy tuck, liposuction of my flanks, a breast lift, breast implants, and I had some loose skin on my back that was also removed. Sorry in advance if I repeat things or I'm mumbling. I am on a little bit of pain medications, not too much, but I am on some. So please forgive me if I repeat things or if I'm not very clear. I'm trying to do the best that I can. Anyway, so this Exparel is like a pain injection that they give to you during surgery, and I got 2 vials worth of it, and to me, I mean, it truly helped. I have never had this big of a surgery before. I've had a few surgeries previously, but I've never had a surgery like this before. And the night that I came home, I wasn't in any pain until about 2 a.m. So I can't get up to go to the bathroom all the way yet on my own. Josh comes and helps me, does that. He gets my drinks, my water. He's been such a big help and has been very supportive. So I'm really thankful for him. I've been able to eat okay ever since Thursday night. Thursday night when I came home, I was pretty nauseous and I wasn't able to really eat or drink because I was throwing up. But ever since then, since the anesthesia wore off, I have been doing okay. I've been able to eat and drink and hold everything down. I am taking Percocet for the pain and ibuprofen to help with the pain as well, just to keep it at bay so it doesn't flare up at all. So I will talk about my surgery. So I had to be at the surgery center at 7 a.m. on Thursday morning, and my husband could not go in with me at all. He had to drop me off outside, and it was scary, and I was upset. I didn't want to go in there and be alone, but with COVID and the restrictions, that's the rules. And I walked in, I had to get my temperature checked, and then the nurse took me into the station to confirm my age, my name, all my information I filled out online. Then I got this wristband here, so the other side has all my information, but I got this wristband here, just so that the nurses each time would check, verify that that's who I am. This is an allergy bracelet because I'm allergic to Bactrim. So when I first go back, they make me do a urine test for pregnancy, which I already have my tubes tied. But since it was within the last 3 years, it was last year, but since it was in the last 3 years, they make you do a pregnancy test. So I had to leave a urine sample. Of course, the pregnancy test was negative, and then they get me set up in this little like triage room and get fully undressed, put my gown on, put, you know, those brown socks with the sticky stuff on the bottom, put those socks on, and they got me started with IVs. They put the IV in my hand. It still has some like the tape on it. So they put the IV in my hand. They confirmed all the surgeries that I was doing that day and confirmed all of my information. And then the doctor came in and did his markings. It was pretty quick. We re-explained everything, all the surgeries that we were doing, where the markings would be, where he'd be doing all the procedures, the cuts, incisions. And then the anesthesiologist came in and he introduced himself and asked me a bunch of questions about my medical history and all that good stuff. So then they wheeled me back into the operating room. And like I said, I've had surgeries before, and I remember going in the operating room and sitting there being freezing and like waiting for them to put me under. But this time they wheeled me in the operating room. They had me go onto the operating table, like I kind of move over onto the operating table, and I already had the IVs hooked up. And then they're like, okay, breathe some oxygen. They put the oxygen mask over, and I was out. I don't remember anything. Like, that was it. I don't remember waking up very much. I had a really hard time waking up after anesthesia this time. They put a patch on my neck right here for anti-nausea because I get so sick because of anesthesia. And I remember them putting the pad on. They put the little patch on before going to the operating room. And then when I woke up, my eyes weren't awake, but I was awake. And I was telling the nurse, like, I don't feel good. I feel like I'm going to throw up. And she opened, like, alcohol wipes and would wave it in front of my nose and tell me to breathe in and breathe in. So that helped a little bit. I didn't end up throwing up, but I remember taking, like, a little bag with me into the car in case I had to throw up, but I never threw up until later on that night when I was already home. I don't remember getting dressed. I don't remember going into my car. I do remember the nurse telling me about this bracelet and that I must keep it on. I remember the nurse handing me a card with my implant information, and she's like, keep this in your purse. You're going to want this. This is for you to keep at all times. So I do remember that as well, but I don't remember my eyes being open and seeing anybody. I just remember that in my head. So it's really weird because in previous times I've had surgery, I would wake up and cry. I would cry every time I wake up from anesthesia, and that did not happen this time. And so they ended up taking the patch off because they say it can make you very, very drowsy, and they thought maybe that's one of the reasons why I was having a harder time waking up. So they took the patch off. So the surgery was about 5.5 hours, I believe, which is what the doctor expected, which is what he told me how long it would take beforehand. So my husband said he was getting worried at home because it was nearing that time and none of the nurses had called him yet. So he was a little bit worried. So I came inside and I just needed to rest. So I laid down for a little bit and then I checked my phone, and I wasn't really hungry, but I was thirsty and my throat was really dry and really sore, and that's from the breathing tube that gets put down your throat. So at that point I tried drinking some naked juice, and I took 2 sips and I couldn't hold it down. And that was one of my worst fears, was throwing up after having like abdominal surgery because your muscles like contract, but I was still under anesthesia, so it didn't really hurt, which was good. Around 2 a.m. is when I started experiencing pain. So I took my first dose of pain medications at 2 a.m. I got home around, I think, 5:30 p.m. on Thursday night. I think is when I got home. I don't really remember, honestly, but I want to say somewhere around there. And yesterday was Friday. It was a smooth day. Experienced some pain. Again, just stayed on top of my pain medications. That makes it go away. I would get up to use the restroom and kind of stretch my legs a little bit. Today is Saturday, like I said. I went to my post-op appointment. He took the wrap and the bandages off and all the tape off, and I got to see my body, and I was so excited and I'm so happy. And I know I still have a long way to go to recover, but just seeing myself and how thin I was and like how flat my stomach is, it was huge. So I was super happy. I will insert a picture like right here of like a before and after of my stomach. So if any of you get queasy or you can't look at blood or stitches or incisions, please fast forward this part because I want to show it for people who want to see it, but I don't want to offend anybody who doesn't want to see it. So this is your warning. So I'm going to post it now. Yes, so that is my belly and my boobs. If you guys watched my pre-mommy makeover, I explained that I was getting an anchor lift, which is the full lift. Well, when I went in to see my doctor today, the first thing I want to talk about is your breasts, because I did not need to do the full lift because the size of the implant that I got and the size of my like pre-existing breast tissue, I wouldn't have had enough skin to do a full anchor lift. So he did like a crescent lift. So the lift is only on the tops of my areolas is where it is cut open. So they're all kind of like bunched together, like on the top. So that's why I have this. This is all bruising right here. So it's not my nipple or anything. It's just bruising. But that's where they are. Then he put the implants in, and I was going to go with 600 cc saline implants. And my left breast has always been bigger than my right because after I had my first daughter, I had to have emergency surgery on my right breast to drain an abscess after getting mastitis, and doctors did not listen to me. So my right breast has always been smaller than my left breast. So during surgery, he sat me up on the table, inserted both saline implants, filled them both to 600 cc's, and my left one was a lot bigger than my right one. I did get to see my pictures today. He showed me my pictures of my breasts during surgery with both of them filled before the lift, and then also with one being totally filled with the lift and then one not being lifted or filled at all. And you could just night and day difference. It's so amazing what these doctors could do. Anyway, so my left implant is actually only filled to 500 cc. And my right breast implant is filled to 600 cc. So that's how much of a difference there was. So they look much more even now. So this one is 500 cc saline implant, high profile under the muscle. And this is a 600 cc saline implant, high profile under the muscle. They look good. Like, I am happy to have cleavage. I'm happy to have nipples like right here instead of facing the floor, because that's how it was before. They were so droopy and so saggy, and I'm only 29 years old and I hated my breasts. So just seeing them, even though they're so bruised and there's incisions and swelling and like my implants are still all the way up here, I still love them. I love looking down and seeing cleavage and perkiness. And I couldn't be any more happier. I've worked really hard, and like I said before, I've carried babies, and I gave up my body to carry babies, and then I also struggled with my mental health and was on medications for a while and gained a lot of weight. And just to be in this position now, to be in a healthier mindset and be able to afford a surgery like this and have the most supportive husband in the entire world, and even my family has been there for me and they're helping me with the kids. Like, I am beyond grateful and thankful and truly blessed to be in this position where I am in my life. So this is just a little update of 2 days post-op and a little bit of my experience in the surgery in the OR. I think my next appointment is in like a week and a half. And at that point, some of my sutures might be able to come out. My drains will come out at that point. I still have my drains on. Here are my drains. I have underwear on, so don't worry. But these are my drains that I'll have hanging for about 10 more days. And I appreciate all of you for watching and messaging me and commenting and wishing me well. I appreciate all of you, and I hope everyone is doing well. And I will see you guys real soon. Bye.